Okay, so we're going to start today with just a short presentation from me about, I guess, my story and the foundation and what we do. But I have to show you this wonderful collage of buildings that were illuminated pink in Chicago this past April for MOGAD Awareness Month, organized by Anne-Marie Nauraki, who is our Illinois ambassador. This was the coolest thing I've ever seen. So cool. We have the Prudential Plaza, John Hancock Center, North LaSalle, West Madison, Chicago City Hall, the Willis Tower. I mean, these are what dreams are made of. So thank you, Anne-Marie, for organizing that. That was super cool. All right, so I love this quote. It says, "A rare disease may also provide rare gifts: perspective, resilience, creativity, compassion, connection, and love." And I heard this from a doctor. Actually, he's from Chicago, Dr. Al Friedman. He's a psychologist who I met at Amgen headquarters last summer, and he said this, and it totally resonated. And as you hear my story, you'll probably hear me say a few times that getting NMO is probably the best thing that ever happened to me. It's very strange to say that, but in so many ways, my life became more colorful despite losing vision. I could see more despite having, being blind in one eye, and just, that led me to the work that I get to do now, which is to meet all of you, travel the world, help research, meet patients, and do whatever I can to help the cause. So I really love this quote. So the genesis of the Sumaira Foundation really started with me. 11 years ago, around this time, I was diagnosed with seronegative neuromyelitis optica spectrum disorder after vision loss and weakness in my body. And at the time, everything on the internet said that you were going to die within 5 years of getting diagnosed with this disease. We had no FDA-approved therapies, and the prognosis was just bad. But of course, that wasn't enough of an answer for me. If you know me, I just celebrated my birthday 2 days ago, so I'm a Leo. Thank you. I don't take no for an answer. So I looked on the internet and I was like, there has to be a good story out there. There has to be something in the mix that's good for this disease. And so I'm going to skip over that slide. Somebody sent me this quote when I first got sick that said, "There was a flower in her heart. It just needed more room to bloom. And when she let it free, she showed the world that sometimes the most beautiful things can grow in the darkest of places without the need of light." This truly resonated me, and a light bulb went up. Within weeks of my diagnosis, I was like, maybe I have to do something about this. I worked in the entertainment industry from when I was 3 years old until 24, so I'm not shy. And I studied public relations at Boston University, and I was working in healthcare when all this happened. So I kind of put all of these ingredients together and baked this little cake, which is the Sumaira Foundation. So 2 months after my diagnosis, I launched the Sumaira Foundation. And now I will tell you about who we are. So we're dedicated to raising awareness of rare neuroimmune disorders like NMOSD and MOGAD. We're very passionate about building communities of support for patients and their caregivers. We fund research and we advocate on behalf of patients. We have 4 pillars, so awareness, community, advocacy, and research. Very proud to be truly patient-led, patient-powered, science-driven, and therapy agnostic. Our icon is a pink Gerbera daisy, so I obviously love pink. No surprise here, but it symbolizes admiration, adoration, and high esteem for someone. The unicorns that you see kind of scattered throughout the room, that's our mascot, and this was in honor of a 6-year-old NMO patient who lost her life to the disease in 2019. She loved unicorns, so this was our way of honoring her, her family, but also all the children and patients living with these rare disorders. And our official colors are pink, orange, and marigold. We believe that diversity is a superpower, despite what anyone is saying out there. I think that's what makes the world go round, and that's what makes our foundation so special. And that's reflected in our International Medical Advisory Board, our Global Ambassador Program, our multi-language content and programming, and we have legal entities spread out across the world. So we are a global organization. We're, of course, based here in the United States, but we have team members all over the world. We have legal entities in Canada, Italy, France, Germany, now expanding into the UK and the Middle East. But that doesn't mean that that's where our work is limited to. We work everywhere. Our website is available in 26 languages. And these are just some of the highlights of the foundation over the last 11 years. We've shared about 175 stories from around the world, from patients, caregivers, clinicians. We've produced 140 webinars and podcasts in 14 different languages. We developed the first ever interactive NMOSD therapies chart, which I think is printed out at the front. We have 102 ambassadors representing 35 countries, which is so cool. This is actually our 15th patient day in 2 years. I feel like 15 is a good number. Yes. We have support group meetings in 10 countries. We funded about $1 million in seed grants and fellowships since 2018. We've graduated 7 fellows who are trained in diagnostics on how to better diagnose these rare conditions. And we're a recipient of 2 PCORI funding awards, which I'll tell you about momentarily. And last but certainly not least, we've secured about 40 plus state proclamations to recognize March as NMO Awareness Month and April as MOGAD Awareness Month. And we co-developed the first ever NMOSD diagnosis and treatment guidelines for Latin America. So, of course, my name is on the foundation, but it takes a village. There are many people working tirelessly to make our mission happen. So, Michael, say hello. I'll point out the people who are here. Look at him with his pink little cast. That's so cute. Jasmine's here from San Diego. Hello, Jasmine. Jill is running around somewhere. She's our chief of staff. We have Grace here with us. Where's Grace? Somewhere. Oh, there she is. Okay. But anyway, we've got quite the team. We have a board of directors, strategic advisors, and then our core team. We like to create a career path for patients. So a lot of the people on our staff are actually patients who have NMOSD, autoimmune encephalitis, and MOGAD. This is our medical advisory board. I won't read every name, but what did you say? It's like a soccer team thing? Fantasy football league? Yeah, I guess in sports this would be great. These are all of our industry partners that we work with. We have all of these community partners we work with around the world. Teamwork is the dream work. We really believe in collaboration. The ambassador program, I will quickly go through this. So we launched our ambassador program back in 2019. Marie and Anne-Marie are actually OG ambassadors. They've been with us for 6 years. But these are patients, caregivers, clinicians, scientists, researchers, and advocates who want to kind of pay it forward and lead the mission in their local territories. As I said, these are our local ambassadors. Thanks for being here. Just some statistics about our ambassadors. So we've got diversity is key. And yeah, just in short, our ambassadors are sources of hope, information, inspiration, knowledge, and resources. These are people who have been affected by the diseases in some way, shape, or form and just want to go out of their way to help other people. So a really beautiful community that we've built. Some of their beautiful faces. Okay, programming. So we're very passionate about patient education. I personally believe that knowledge is power. Michael will always tell me it's always good to get smart on things, especially when it relates to yourself, so you can better advocate for yourself. So we've got webinars, podcasts, guides, infographics, case discussions, lecture series. You can find them all on our website and on YouTube. This is our new NMOSD and MOGAD brochure. I actually did this myself, but it's a passion project. I've been wanting to do this since the genesis of the foundation, just to be able to go home with something that has your disease on it, has so much value. You just don't feel crazy anymore. So let me know what you think. We recently launched Side by Side, which is a program dedicated entirely to shared decision making, which is something I hope that we have the chance to talk about today. There are videos, there are infographics, guides, checklists, the whole shebang. Thank you, Amgen, for supporting that. We illuminate the darkness by sharing patient stories, as I said, through Voices of NMO and MOG. We have a docuseries that we've been filming for 3 years. And one of them actually became a finalist at the World Health Organization Film Festival in 2023. This is from a documentary I did with Dr. Sean Pittick, who is like the big kahuna in NMO at Mayo Clinic. I am a very ugly crier, and I feel like this entire documentary I was crying. So you can watch it on YouTube, but just a fair warning in advance. Some of our support group meetings, they go as far as India. You know, we've had some in Thailand. We have them in Germany and Italy and Sweden, so really neat stuff. Mental health, wellness-focused initiatives exist in our foundation. These are all the patient days we've done, and 2 more this year in America, Salt Lake City next month and Seattle in October. I'm a big Beyonce fan. I'm definitely a member of the Beehive, and I joke and say that this is kind of like my own little Renaissance tour. More meaning, I would say. So not as cool dancing, but, you know. These are just some photos from our patient days. You'll notice that there are these group photos. We're going to do it here, and it has to be the best one ever. This was from Denmark at Patient Community Day at ECTRIMS last year. I got to represent our diseases there. More patient day photos. This was from our Beijing patient day last year. That was so cool. And this was at Stanford and San Francisco in March. Washington, D.C. was our last one last month, yeah. And then we're going to do one today. We have an app called NeuroSum. It's a symptom tracking app. I think we have QR codes kind of spread out. Check it out. Give us some feedback. Let us know what you think. We have these unicorns, and we have a pediatric support program. So anytime I become aware of a patient under the age of 18 who is diagnosed really with any of these diseases, I send them a care package wherever they are in the world with a handwritten note, hopefully to make them feel better. Advocacy is obviously very important to us. We have a patient advocacy council and a coalition for health equity. Both are similar in that we're trying to solve problems. We'll identify gaps, do needs assessments, and solve problems so that patients can get diagnosed quicker, more accurately, get access to therapies, and so on and so forth. March is NMO Awareness Month. April is MOGAD Awareness Month. This was to commemorate China NMO Day, which is celebrated on May 25th. This was a huge, what do we call it? Billboard in Shanghai. These are some illuminations around the world. So Niagara Falls, that's Gran Guardia in Verona, Italy, the Zacum Bridge, the Empire State Building, Michelangelo in Florence, Italy, and the CN Tower. But Chicago is still the best. These are just some photos from advocacy efforts. That's our Belgian ambassador at the European Parliament, and then a bunch of us on Capitol Hill during Rare Disease Week on Capitol Hill. These are some of the patient assistance programs that we work with. So PAN Foundation, the Assistance Fund, Good Days, and NORD, they all have programs to support copay assistance, if you need Ubers, to and from infusions, like all kinds of things. So if that's ever a need, definitely go on our website and see what they can offer. Research. So we have 2 research grants, SPARK grants, which is for adult research, and Joanni's Unicorn Grant, which is for pediatric research. And since 2018, we've funded 32 projects in the amount of $830,000. We've graduated 7 fellows from Iran, from Zambia, Sri Lanka, Brazil, Egypt, and Belgium. And these are folks who trained at the University of Oxford, University of Verona, or Mass General Hospital, learning live cell-based assay testing. I'm not a science person, so for me to say that, it just took a lot of effort. But for the doctors in the room, you know how important that is for diagnosing, so we're very happy to continue supporting this. We have also co-sponsored alongside Alexion the first ECTRIMS Mead Fellow at the University of Oxford. This is Dr. Antonia Lefter. She's from Romania. She will be at the University of Oxford for 2 years, starting in December, focused entirely on NMOSD and MOGAD. We also support publication fees for journals. So in open access journals, sometimes for these doctors, it's like $3,300 to publish a paper, which is ridiculous. So we funded 12 articles from 9 countries for MOGAD-specific articles at the Frontiers in Neurology, and now we have a partnership with N2, which is like the Neuroinflammatory Disorders publication, funding journals from researchers in lower middle-income countries. We have research summaries, so these are plain language research summaries. This program is entirely led by a patient on our team. She's from India. Her name is Clarinda. She has a science communications background, and the idea is to translate all of this incredible research that's always coming out and turning it into plain language summaries so that people like me can understand what all this research is about. And then last year, we received a $250,000 funding award from the Patient-Centered Outcomes Research Institute to develop a research agenda for rare neuroimmune disorders. And that's working with all stakeholders, so patients, caregivers, clinicians, advocates, industry partners. And then in April of this year, we received a $9 million funding award from the same institution. Yay! To conduct an international 5-year comparative effectiveness trial looking at the 4 FDA-approved therapies for NMOSD versus the off-label rituximab. So lots of learnings over the next 5 years, but we're very excited and hoping to get information that the community has been wanting for a long time. So that's a little about the trial. We can skip over that. Oh, this is my favorite picture ever. So this is from Beijing last year where we turned 10 years old. Obviously, I'm blowing out the candle, but the best part of this photo is that's Michael Devlin right there in a birthday hat. He hates this photo. And then that's Dr. Michael Levy in a birthday hat, too. If you don't know him, he's at Mass General Hospital. He's the chair of our medical advisory board. Nicest guy ever, but really, like, a dad to all of us with NMOSD and MOGAD. And this is us on social media. So that is all I have to share about me and the foundation. Again, thank you so much for being here. We're so excited for the day. And without further ado,